So today I will be talking about how do you diagnose emphysema on a chest X-ray. Now, if we talk about pleural effusions or pneumonic consolidation, it's very easy to pick it up on a chest X-ray, but emphysema is a bit difficult. So, number one, if you have to diagnose emphysema on a chest X-ray, the very first thing important is that the history should be suggestive of emphysema. So, usually emphysema does not occur in acute conditions. It usually occurs as a complication of chronic conditions like chronic lung disease, chronic lung infections, some of the connective tissue disorders that can affect the lung parenchyma as well. So, if there's a history of chronic respiratory problems, and if you are thinking emphysema, then you have to do a chest X-ray as the first step. So, what are the important key features in chest X-ray that will point towards emphysema? Now, the very first thing is overinflation of the lung fields. Now, what do you mean by overinflation? Overinflation means because in emphysema there is air trapping. There's a lot of air in the lungs. The air can go inside, but it's not easy for the air to come out. So there is air trapping. What it leads to? So lungs are overfilled with air. How do you know it on a chest X-ray? So if you count the anterior ribs, normally in a normally inflated lungs, usually the anterior ends of the fifth and the sixth rib, they only touch the diaphragm. In case of overinflation, because the lungs are overinflated, you will see that anteriorly the seventh and the eighth rib, or if you're counting the posterior ribs, that the ninth and tenth would be touching the diaphragm. So the first thing is that you would be seeing that the seventh, eighth anterior ribs or ninth, tenth posterior ribs would be touching the hemidiaphragm. Number two is that the diaphragms are flattened. So if you draw a line along the convexity, normally the diaphragms are convex. So if you draw a line between the two ends of that convexity and then you take the topmost part of that convexity, usually it should be more than 1.5 centimeter. And if it is less than 1.5 centimeter, it means that the diaphragms are flattened. So the pressure of the air flattens the diaphragm. So there will be flattening of the diaphragm. Number third thing is that there will be coving of the diaphragm. So coving of the diaphragm means that normally the diaphragm is a convex dome shape, but when there is air trap, you will see that convexity is lost. So at some points it will be convex, at certain points it will be more of a irregular shape. So the third sign is what? Coving of the diaphragm. And the fourth thing is what we call cephalization. So cephalization means that there is more prominent bronchovascular markings in the upper lung fields, in the upper lung zone. So the area that is within the first and the second ribs on the both sides, you will see that there are more bronchovascular markings in that area. So we call it cephalization. So these four things are suggestive of emphysema. Number one, air trapping. Number two, flattening of the diaphragm. Number three, coving of the diaphragm. And number four, cephalization of lung blood vessels. This way you can pick it up, the emphysema on a chest X-ray. Hope you have learned something new. Take care and bye bye.